Thank you, Rhea. You know, I've learned a lot on your first sessions, and I'm sure our families that will be watching now and later will also. So moving on to the next section of your presentation on the psychological aspect of pain, and you know, one of the big questions is around what impact having pain can have on mental health. So thank you.
Yeah. So I think the psychological aspects of pain are one of the areas that isn't focused on as much. I think we're very good at focusing on trying to give people medications and trying to provide drugs for their physical pain. But I think sometimes the psychological aspects get forgotten about. So the impacts that pain has on an individual from a psychological point of view is vast. People can experience trauma from the pain itself, either from how they got the pain from their cancer or their cancer treatment, depression, anxiety due to the impact that the pain has on their ability to live their lives, things like a sense of loss and grief as well. And I think that's one area that is definitely not discussed or not recognized as much as should be, that actually by having something like pain, especially if it's long-term pain rather than kind of acute pain that settles, but that more chronic persistent pain, it becomes a long-term condition. You have to find ways to live alongside it, to be able to function and still manage your life. And that's really, really hard. And the amount of losses that people experience with a long-term condition involving pain, you know, the loss of role. So maybe how you perceive yourself as a mum or as a wife or as a daughter or sister, or, you know, it massively impacts our role in our life, our occupation, our work, all of those aspects as well. So it's really important to recognize that grief and that loss that can be experienced, and get support for that as well. You know, we're very good at trying to provide support for people who've lost a loved one, for instance, or somebody has died and they're grieving, but actually grieving, you know, how you were in your life before you developed this pain, that's really just as important, and really, you know, yeah, it's a vital aspect that needs to be looked at. There's also issues around validation and recognition of the pain and the psychological impact. So again, some health professionals and some of our loved ones maybe not quite as good as recognizing that we have pain, or how the pain impacts us, how the pain's affected us. And that can be really, really hard when sometimes people may feel that they're not believed, or that their pain isn't being recognized by people around them, whether it's professionals or their family members. And that's really, and again, that's something that's really important. It needs to be recognized, it needs to be validated, that actually the pain, from whatever the cause of it is, it needs that recognition, that importance of knowing that it's real, and the massive effect that it has on people's lives. And again, we're not very good at managing that, and generally, unfortunately, as health professionals, it tends to get pushed far more to the side. I think it's much easier to give somebody drugs or an injection than it is to talk to them about all of the other aspects that, you know, the pain has affected. The problem with pain as well, with the psychological side of things, is that it's twofold. So not only does the pain have a massive impact on our lives and on how we feel, how we think, how we behave, our relationships with other people, but also all of those things then have an impact on our pain as well. So we know that people with a history of trauma, depression, anxiety have a much higher risk of developing persistent pain, because the parts of your brain that process pain also process those emotions and memories and beliefs and things as well. So it's definitely a twofold thing, that they both impact each other massively. But there are things that can be done to try and support that. So I think having these support services, having the forum, is such an amazing support for people to be able to reach out and just talk about their experiences and how their lives are being affected, and get that recognition and that validation without that judgment from people, without any kind of comments. I've heard people being told that their pain's all in their head, or, you know, that they should just be grateful that they've not got cancer anymore. And it's just awful, and it needs to be addressed, and it needs to be looked at more. So I think the more support we can offer, whether it's through forums or through charities, or generally just educating health professionals more about how to work with people with long-term pain, is really, really important, and something that I'm very, very passionate about. So psychologically wise, to try and manage some of those impacts that the pain can have, it's really important to access some of those services out there. So things like, I'm not sure in different areas what they're called, but the psychological services. So around here, or like the IAPT, the Access to Psychological Therapies, who support people with anxiety, depression, trauma. There are specific therapies such as cognitive behavioral therapy, acceptance commitment therapy, that have really good evidence base for helping people manage their psychological impacts of pain, and also vice versa has a knock-on impact on their pain levels. Then a lot of people find that if the psychological impacts of their pain are better managed, that actually their pain itself can be easier to manage. So it has that positive cycle rather than that vicious cycle then. And part of that is because of that, so our nervous system, how our body is, when we're stressed, we get lots and lots of these horrible chemicals produced in our body that do really good things short term, like make us get our muscles ready to run faster. It goes back to when we were like cavemen and stuff and had to run away from creatures. And but if that goes on too long, that permanent release of those stress hormones can keep our pain levels quite high. And then we're not accessing that part of our nervous system that can help bring those pain levels down. So again, it's really important by managing some of those psychological consequences, doing things such as mindfulness, relaxation, distraction, just adding more positive things into your life that you really enjoy. So I always say to my pain patients that if there is anything that you enjoy doing, anything at all that gives you a positive feeling, a buzz that makes you happy, that can take your mind away from the pain, it can actually help produce lots of those natural painkillers. So your natural morphines and things that can help turn the volume down on your pain as well. So not only are you getting to do more, but it's actually helping the pain itself. So yeah, so the psychology and pain is so connected and so linked that we can't separate them. So we have to acknowledge it and offer that support for people who are having that kind of impact from their pain. Not everyone will necessarily experience all of those things as part of their pain, but I think especially when you've got pain because of cancer and cancer treatment, it becomes even more prevalent because of the trauma and the frustration. I know I've got a couple of patients who have a lot of pain post-cancer treatment, and they find it really, really hard to manage the fact that they've had their treatment and actually they've now got a worse quality of life than they had before. And this is where having those specialist services are really important, because they can provide the psychological support as well as the physical support to try and manage it from every angle. And this is why I say make sure that, you know, if you are struggling physically or emotionally, it's really important to reach out, speak to your GP, speak to your oncology team, and get a referral to the specialist services that there. You know, that's what we're here for. That's why we have multidisciplinary teams with physios and occupational therapists and psychologists involved, so that we can give true kind of holistic support to people as well. There are some really, really good resources out there, and I'm going to provide kind of a list of resources for the mummies to have a look at. Which include websites that give really good information about self-management strategies. So things like relaxation techniques, breathing techniques, ways that you can maybe look at your activity levels and kind of pace your activities a little bit more. Just really nice hints and tips. And a lot of them are written by patients who themselves have got pain. So it's quite nice. It's not just a health professional saying you should do this. It's actually coming from patients who've learned it from trial and error. And a lot of my patients feedback to say that they're really useful resources. So I'll make sure that I'll give a list of resources to you guys so that you can share that with the mummies as well. Yeah,